Welcome to the Advanced Health Equity Impact Assessment professional course presented by CDGTraining. Health outcomes are not experienced equally across populations. Differences in income, education, geography, gender, ethnicity, disability, and access to services often create significant health disparities that affect millions of people worldwide. This course provides a practical framework for evaluating policies, programs, services, and decisions through a health equity lens. You will learn how to identify inequities, assess impacts, engage stakeholders, and develop strategies that promote fairer health outcomes. Health equity means that every individual has a fair and just opportunity to achieve their highest possible level of health, regardless of background, identity, or circumstance. Achieving health equity requires removing barriers such as poverty, discrimination, social exclusion, and unequal access to healthcare services that prevent people from reaching their full health potential. Health equity focuses on fairness and recognizes that different populations may require different levels of support to achieve comparable health outcomes, not identical treatment, but just treatment. Understanding the distinction between equality and equity is essential in health policies and programs. HealthEquality provides the same resources to everyone. Different starting points result in unequal outcomes. Health equity recognizes different circumstances. It tailors support to level the playing field and achieve equal outcomes. It's about giving people what they need to reach the same level of opportunity and health outcome. Health is influenced by far more than medical care alone. The conditions in which people are born, grow, live, work, and age shape their health outcomes profoundly. Safe, stable housing and clean environmental conditions are foundational to good health outcomes. Educational attainment and stable employment directly influence income, health literacy, and access to care. Access to affordable, nutritious food is a critical determinant of physical and mental health across all ages. Reliable transportation enables access to healthcare services, employment, and community resources. Strong social networks and community connections protect against isolation and support mental well-being. Economic resources determine the ability to afford healthcare and safe living conditions. Decisions made by governments, healthcare organizations, and community agencies can affect population health in profoundly different ways. Even well-intentioned policies may inadvertently widen existing disparities. Groups that are already disadvantaged may experience greater negative impacts while receiving fewer benefits from new programs or services. Health Equity Impact Assessments, HEIAs, identify who may benefit from a decision, reveal who may be disadvantaged, explore strategies to reduce inequities, promote transparent decision-making, support inclusive planning processes, and strengthen accountability to communities. Health inequities exist in every region of the world, affecting billions of people across diverse social, economic, and geographic contexts. Healthcare access remains unequal, leaving many communities without adequate care. Significant differences in life expectancy exist between high-income and low-income countries, and within nations themselves. Maternal mortality rates vary dramatically across regions, reflecting deep inequities in reproductive healthcare access. Infectious diseases burden falls disproportionately on low-resource settings in many vulnerable populations. Preventive care gaps in screening, vaccination, and treatment services contribute to many vulnerable populations globally. Global organizations continue to work toward reducing these inequities through coordinated policy, strategic investment, and evidence-based public health initiatives. Certain populations face greater health challenges due to social, economic, geographic, or systemic barriers. Health equity assessments help identify and address the unique needs of these groups. Economic hardship limits access to healthcare, nutritious food, safe housing, and preventive services. Racial and ethnic minorities often face systemic discrimination, cultural barriers, and disparities in care quality. Displaced populations face long-term language barriers, legal restrictions, and disrupted access to healthcare systems. Indigenous communities experience historical inequities, geographic isolation, and culturally inappropriate services. Aging populations face mobility challenges, social isolation, and complex multi-morbidity issues. Persons with disabilities encounter physical, cognitive, and sensory disabilities that create barriers to accessing standard healthcare services. Policies and programs can unintentionally create or worsen health inequities if equity considerations are not included during the planning phase. Even well-resourced, well-intentioned initiatives may fail to reach those who need them most. Decision-makers who do not examine equity impacts risk implementing programs that benefit already advantaged populations while leaving vulnerable groups further behind. A proactive approach requires decision-makers to examine potential impacts before implementation, not after harm has already occurred. This proactive process supports more inclusive, effective, and accountable outcomes for all communities. A health equity impact assessment is a structured evidence-based process used to evaluate how a policy, program, or service may affect different population groups, before, during, or after implementation. The assessment identifies potential positive and negative impacts and explores strategies to reduce inequities. HEIA is increasingly used by governments, healthcare systems, and public health organizations worldwide to ensure that decisions promote rather than undermine health equity. Many international organizations support health equity initiatives, providing guidance frameworks that help organizations integrate equity considerations into planning and evaluation processes. WHO's Commission on Social Determinants of Health provides foundational frameworks for addressing the root causes of health inequities globally, guiding national and regional health equity strategies. The UN Sustainable Development Goals, particularly 3 Sudanese pounds, good health and well-being, and 10 Sudanese pounds, reduced inequalities, provide a global roadmap to achieve health equity by 2030. The World Bank and national agencies provide investment frameworks, data tools, and policy guidance to reduce and resolve health disparities across populations. The course is structured as a progressive learning journey, with each chapter building practical knowledge that can be applied across healthcare, public health, government, and community settings. The learning pathway is designed to support both new and experienced professionals across all sectors of health and public policy. Successful health equity professionals combine analytical thinking with empathy, community awareness, and evidence-based decision-making. These qualities together enable meaningful, lasting change in health systems. As you progress through this course, focus on understanding how policies and programs affect different populations in real-world settings, not just in theory, but in the lived experiences of communities. The knowledge gained will help you contribute to fairer, more inclusive, and more effective health systems worldwide. Systems that leave no one behind. Welcome to the foundation of Health Equity Impact Assessment, a structured approach used to evaluate how policies, programs, and decisions affect different population groups. In this chapter, learners will explore the purpose, principles, benefits, and practical applications of Health Equity Impact Assessment within healthcare and public health systems. Understanding these concepts helps organizations create more equitable and inclusive outcomes for all communities. A Health Equity Impact Assessment, often called HEIA, is a systematic process used to identify how a proposed decision may affect population groups differently. Key functions include anticipating impacts and supporting evidence-based decisions, helping decision-makers foresee both positive and negative effects before implementation. Health outcomes are influenced by social, economic, environmental, and cultural factors. Different populations often experience unequal access to healthcare, education, employment opportunities, and healthy living conditions. Health equity seeks to reduce avoidable and unfair differences in health outcomes across all population groups. The primary purpose of HEIA is to identify potential health impacts across diverse populations. It helps organizations recognize unintended consequences and develop strategies that reduce inequities. By identifying impacts, reducing inequities, and strengthening accountability, HEIA builds fairness and transparency into organizational decision-making processes. Health equity assessment emerged from public health, social justice, and population health movements. Governments and healthcare organizations increasingly recognized that decisions can affect communities differently, leading to the development of formal assessment frameworks. Health equity assessments are built upon foundational principles that ensure vulnerable and underserved populations are considered during decision-making processes. The goal is to improve outcomes for everyone through fairness, inclusion, transparency, participation, and accountability. Health inequities are differences in health outcomes that are avoidable, unjust, and preventable. Identifying these inequities is a key step in the assessment process. Unlike natural health differences, inequities result from systemic barriers and social conditions that can be changed through deliberate policy and action. Understanding the distinction between equality and equity is fundamental to effective health impact assessment. Equality means providing the same resources for everyone, regardless of need, while equity involves tailored support based on need to achieve comparable outcomes. Many factors outside of healthcare directly influence health outcomes. These factors, known as social determinants of health, have the greatest impact on population health and play a central role in health equity assessments. Health equity impact assessments are used by a wide range of stakeholders who make decisions affecting population health. HEIA is increasingly recognized as a best practice internationally, involving governments, hospitals, public health agencies, community organizations, and policymakers. Organizations implementing health equity assessments often experience meaningful improvements across multiple dimensions of decision-making and community outcomes. Benefits include improved decision quality, reduced unintended harms, stronger community trust, and effective resource allocation. A typical HEIA process follows a structured sequence of steps that together provide a comprehensive understanding of potential equity impacts. Each step contributes to consistency and effectiveness, ensuring no population group is overlooked during the assessment. Stakeholder engagement is central to successful health equity assessments. It ensures that diverse perspectives are considered, helping to address multiple systemic barriers and build trust within the community. Effective engagement supports both the quality and the legitimacy of assessment findings. HEIA relies on a combination of data, research, community knowledge, and professional expertise. Evidence helps decision-makers understand population needs and evaluate potential impacts with confidence, strengthening recommendations and building trust among stakeholders. Organizations may face a range of challenges when conducting health equity assessments. Despite these obstacles, structured processes consistently improve decision-making outcomes by emphasizing transparency and collaboration. A regional healthcare authority planned to consolidate several clinics into a single central facility to improve operational efficiency. HEIA revealed that the proposed changes would disproportionately affect low-income and elderly residents, leading to the introduction of mobile healthcare services and transportation support programs. Health outcomes are influenced by multiple interconnected factors. Social determinants often have the greatest impact on population health and therefore play a central role in health equity assessments. Organizations implementing health equity assessments often experience improvements in decision quality and stakeholder confidence. The process helps identify opportunities for more equitable outcomes across all program areas. Health equity assessment continues to evolve through advances in data analytics, digital health technologies, and community-centered policymaking. Future assessments will become increasingly data-driven and collaborative, helping organizations identify disparities earlier and develop more targeted interventions. Health Equity Impact Assessment provides a structured framework for evaluating how decisions affect diverse population groups. By identifying potential inequities and developing mitigation strategies, organizations can improve fairness, inclusion, and health outcomes for all communities. Health outcomes are shaped by more than just medical care. Social, economic, environmental, and cultural factors play a crucial role in shaping individual and population health. In this chapter, learners will explore the foundations of health equity and examine how social determinants influence health outcomes across different communities and populations. Health equity ensures everyone has a fair opportunity to achieve their highest level of health. It focuses on fairness rather than treating everyone exactly the same. Achieving health equity requires addressing barriers that prevent access to opportunities and resources that support well-being, such as removing systemic obstacles, ensuring fair access to resources, and supporting underserved populations. Population health examines health outcomes across groups and the factors influencing those outcomes. Healthcare services are just one component. Economic stability, education, social support, and environmental conditions all contribute significantly to health status. Social determinants of health are the conditions in which people are born, grow, live, work, and age. These conditions influence health risks, quality of life, and life expectancy. Understanding these determinants is essential for effective health equity assessments. Income and employment significantly affect health outcomes. People with stable incomes often have better access to healthcare services, nutritious food, safe housing, and educational opportunities. Economic hardship is associated with increased health risks and poorer outcomes. Education builds the ability to understand and act on health information, empowering individuals to make informed decisions. Higher educational attainment opens pathways to stable employment and improved socioeconomic status, often associated with improved health outcomes and longer life expectancy. Access to healthcare includes availability, affordability, accessibility, and quality of services. Health equity assessments often examine these barriers closely, such as cost barriers, transportation, language differences, and provider shortages. The environments where people live affect both physical and mental health. Environmental disadvantages often contribute to health inequities, creating cycles that are difficult to break without targeted intervention. Access to affordable, nutritious food is a key determinant of health and chronic disease prevention. Food insecurity increases the risk of chronic diseases, malnutrition, and poor health outcomes across all age groups. Social relationships and community connections influence both physical and mental health in profound ways. Improved resilience under stress, encouragement of healthy behaviors, reduced anxiety and depression, and a stronger sense of belonging are benefits of social connection. Health literacy refers to the ability to obtain, understand, and use health information effectively. Improving health literacy supports health equity goals and empowers individuals to take control of their own well-being. Exposure to air pollutants increases respiratory diseases, cardiovascular conditions, and developmental issues in children. Access to clean, safe drinking water is fundamental to preventing waterborne illnesses and supporting overall health. Extreme heat, flooding, and climate-related events disproportionately affect vulnerable and low-income communities. Health inequities are often influenced by broader social and institutional systems. Addressing systemic factors is essential for sustainable health equity improvements. Policies, economic structures, and historical inequalities all play a role. People often experience multiple overlapping factors that influence health outcomes. Health equity assessments should consider these intersecting influences, such as age, gender, ethnicity, income, and disability. Health equity impact assessments evaluate how social determinants may influence the effects of policies and programs on different populations. Understanding social determinants helps organizations identify risks and opportunities for improvement. A healthcare provider introduced specialized services at a regional clinic to serve a broader patient population. A health equity assessment identified significant transportation challenges for rural populations and older adults in the service area. The organization implemented mobile health services and transportation assistance programs to reach underserved communities. Multiple social determinants influence population health outcomes. Understanding these interrelationships supports more effective equity-focused decision-making. Economic stability, education access, healthcare access, neighborhood environment, food security, and social context all play foundational roles. Research consistently demonstrates that social and economic conditions strongly influence health outcomes. Addressing these determinants can significantly improve population health and reduce inequities. Organizations increasingly use advanced analytics to identify vulnerable populations and target interventions more effectively and efficiently. Meaningful participation of affected communities in health equity planning ensures that solutions are relevant, trusted, and sustainable. Social determinants of health are among the most important influences on health outcomes and health equity. Organizations that understand and address these determinants are better positioned to reduce disparities and improve population well-being. Health disparities exist when certain population groups experience poorer health outcomes, reduced access to services, or greater exposure to health risks than others. In this chapter, learners will explore the causes of health disparities, identify vulnerable populations, and understand how health equity impact assessments help address inequities in healthcare systems and communities. Health disparities are measurable differences in health outcomes between population groups. They appear in disease rates, life expectancy, healthcare access, and overall well-being. Many disparities are preventable and influenced by social and structural factors, not inevitable biological differences. Health disparities are measurable differences that may be natural or unavoidable, while health inequities are unfair and avoidable, stemming from systemic barriers. This distinction supports more precise and effective health equity impact assessments. Health disparities can be observed across countries and within communities, affecting maternal mortality, child health, chronic disease, and life expectancy. These disparities highlight the importance of equitable health policies and programs. Vulnerable populations face increased risks of poor health outcomes due to various barriers. These groups may experience barriers that limit access to healthcare and other essential services. Recognizing vulnerable groups is key in health equity assessments. Income strongly influences access to healthcare, housing, and transportation, contributing to health disparities. Low-income communities often face multiple stressors that worsen health outcomes and reduce the ability to seek care. People living in rural and remote areas face challenges related to healthcare availability, transportation, and workforce shortages. Geographic barriers can lead to delayed care and poorer health outcomes. Health equity assessments evaluate these challenges as part of their scope. Older adults often require increased healthcare services and support. Age-related considerations are important in equity-focused decision-making, addressing mobility limitations, chronic conditions, and social isolation. Individuals with disabilities may encounter various barriers when accessing healthcare services. Inclusive healthcare design and policy can help reduce these challenges, emphasizing physical, communication, and systemic barriers. Indigenous and minority populations experience disparities related to historical, cultural, social, and economic factors. Culturally responsive care that respects cultural values can improve health outcomes and trust building. Migrants and refugees often face language barriers, legal challenges, and economic hardship, limiting access to healthcare. These factors can increase vulnerability and affect health outcomes significantly. Gender can influence access to healthcare, health risks, and treatment outcomes. Women, men, and gender-diverse individuals may experience different health challenges and barriers. Gender-sensitive approaches support more equitable healthcare systems. Early life influences can affect health outcomes throughout the entire lifespan. Protecting child health is a priority in equity-focused programs, as early interventions yield the greatest long-term impact. People often belong to multiple population groups simultaneously, facing complex patterns of disadvantage. Intersectionality helps identify these patterns, ensuring comprehensive health equity assessments. Health equity impact assessments examine how decisions may affect vulnerable populations, aiming to prevent policies or programs from unintentionally increasing inequities. Meaningful assessments require understanding the experiences of affected communities. A healthcare organization introduced a telehealth program to improve access to specialist care across underserved regions. Digital literacy support and community access points were established to bridge the gap, resulting in equitable outcomes. Health equity assessments frequently examine multiple population groups that may experience barriers to health and well-being. Effective assessments consider all relevant groups within the community, addressing overlapping barriers. Health disparities are influenced by multiple interconnected factors. Addressing these causes requires coordinated action across healthcare, social services, education, housing, and public policy sectors. Healthcare organizations increasingly use data analytics, community partnerships, digital technologies, and targeted interventions to reduce disparities. These approaches help identify underserved populations and improve access to services. Health disparities and vulnerable populations are central considerations in health equity impact assessments. Understanding the causes of inequities can lead to more effective strategies to improve health outcomes and reduce barriers. Health equity impact assessments rely on structured frameworks and assessment models to ensure consistency, transparency, and evidence-based decision-making. In this CDGTraining chapter, learners will explore internationally recognized health equity frameworks, assessment methodologies, and practical models used to evaluate the potential impacts of policies, programs, and services on diverse populations. Frameworks provide a systematic approach for identifying, analyzing, and addressing health inequities across populations and policy contexts. They help organizations organize information, evaluate impacts, and develop recommendations using consistent, repeatable methods. Structured frameworks improve the quality and credibility of assessments, building trust among stakeholders and decision-makers. Assessment models are tools that guide organizations through the process of evaluating potential health impacts. They provide structured pathways for analysis and decision support. These models help examine risks and potential negative consequences, opportunities for health improvement, affected populations and vulnerable groups, and possible mitigation strategies. Different models may be used depending on organizational needs and objectives, allowing flexibility in application. Health equity is influenced by social determinants, governance systems, economic conditions, and public policies working together. WHO frameworks encourage organizations to address root causes of health inequities rather than focusing solely on healthcare services. This approach supports long-term improvements in population health and sustainable reductions in health disparities. The social determinants framework examines how living conditions influence health outcomes. Factors such as income, education, housing, employment, and social support contribute significantly to population health. This framework is widely used in health equity assessments. Population health frameworks focus on improving health outcomes across entire populations while reducing disparities between groups. The model emphasizes prevention, community well-being, and coordinated interventions. Population-level thinking is essential in health equity work, shifting focus from individual treatment to systemic improvement. Health impact assessment is a structured process used to evaluate the health effects of policies, programs, or projects. HEA often includes health equity considerations and stakeholder engagement activities, and the methodology supports informed decision-making. The HEA process ensures that health and equity considerations are embedded into policy and program decisions before implementation, reducing the risk of unintended harm to vulnerable populations. In this chapter, we delve into the importance of stakeholder engagement and community participation in health equity impact assessments. These assessments rely on meaningful engagement to capture insights beyond data. Understanding stakeholder engagement involves recognizing the roles of transparency, trust, and decision quality. These elements ensure diverse perspectives are considered throughout the assessment process. Community participation is crucial as it provides real-world insights, relevance, and effectiveness to health equity assessments. It ensures that local challenges and opportunities are fully captured. Identifying stakeholders is essential in the assessment process. Different stakeholders bring unique perspectives that enrich the evaluation, from patients to policymakers. Understanding primary and secondary stakeholders helps organizations design effective engagement strategies. Both groups contribute valuable insights to the assessment process. Effective engagement is inclusive, transparent, respectful, and accessible. These principles ensure genuine dialogue and responsiveness to community input. Public participation can range from informing to empowering stakeholders. Organizations should select approaches that align with their objectives and context. Informing stakeholders is the foundational level of engagement. Organizations provide information about decisions, programs, or changes to ensure awareness and understanding. Consultation involves gathering feedback from stakeholders on proposed decisions. It helps identify concerns and opportunities for improvement before decisions are finalized. Collaboration and co-design involve working directly with stakeholders throughout the decision-making process. This approach leads to more sustainable outcomes. Empowering communities means involving them in decisions that affect their lives. This leads to meaningful influence, ownership, and sustainable change. Organizations must address barriers to ensure inclusive participation. Effective engagement methods improve representation and equity outcomes. Inclusive engagement strategies ensure all voices are heard. These measures strengthen equity outcomes by improving representation across diverse communities. Community-based participatory approaches treat community members as partners. These methods emphasize shared decision-making, mutual respect, and collaborative problem-solving. Stakeholder engagement is crucial in health equity impact assessments. It improves both the quality and credibility of assessments by identifying affected populations and uncovering potential risks. Community input on mental health services revealed cultural and transportation barriers. Addressing these barriers improved accessibility and engagement. Health equity impact assessments involve a wide range of stakeholders. Broad participation ensures assessments reflect diverse experiences and perspectives. Community participation enhances decision quality and implementation success. Organizations that involve communities achieve stronger and more sustainable outcomes. Future trends in community engagement involve digital innovation. Online consultations, virtual workshops, and digital surveys expand access and participation. Stakeholder engagement and community participation are essential components of effective health equity impact assessments. Organizations should engage meaningfully, remove barriers, and partner with communities. Effective health equity impact assessments rely on reliable data and credible evidence. Incomplete or inaccurate information can overlook important inequities and lead to unintended consequences. This training will explore data collection methods, evidence sources, and best practices for gathering information that supports health equity decision-making. Understanding health conditions and identifying disparities across populations is crucial. Data provides a foundation for decision-making, improving the accuracy and credibility of health equity assessments over time. Health equity impact assessments use both quantitative and qualitative data. Combining these approaches offers a comprehensive understanding of health inequities. Quantitative data includes measurable information like disease rates and healthcare utilization. This data provides objective analysis of health patterns across populations. Qualitative data captures experiences, opinions, and perceptions, explaining why disparities exist. It goes beyond numbers to reveal lived realities. Most assessments use both primary and secondary data sources for a comprehensive evidence base. Primary data is original and specific, while secondary data is broad and pre-existing. Demographic information helps identify groups that may experience different health outcomes. It supports targeted equity assessments by revealing who is most affected. Health indicators provide measurable evidence of population health status and help assess health equity impacts over time. Organizations rely on data from public health agencies, healthcare providers, and academic institutions. These sources improve assessment quality and credibility. Surveys collect information from large groups, helping organizations understand healthcare access, lifestyle factors, and community needs. Effective surveys depend on clear design and validation processes. Interviews and focus groups provide detailed information about personal experiences and community perspectives. These methods highlight barriers and opportunities not visible in statistical data. Geographic analysis examines how location influences health outcomes. Spatial analysis supports targeted interventions by highlighting disparities. Data disaggregation involves separating information into specific categories to reveal disparities. It's essential for equity-focused analysis. The quality of data used in assessments is crucial. Poor quality data can lead to incorrect conclusions and misguided policy decisions. Data collection must respect privacy, confidentiality, and ethical standards. Ethical practices are fundamental to trustworthy health equity assessments. A health authority sought to improve access to preventive screening services. They combined various data sources to build a comprehensive evidence base and identified targeted actions. Health equity impact assessments rely on multiple evidence sources for accuracy and depth. Combining data types improves assessment quality. Different methods provide various insights. Combining approaches offers the strongest evidence base for decision-making. Advances in digital health technologies are transforming data collection and analysis. Future assessments will rely on integrated data ecosystems. Data collection and evidence gathering form the foundation of effective health equity impact assessments. Combining quantitative data, qualitative insights, demographic analysis, and ethical practices can develop stronger assessments and better recommendations. Every policy, program, or service can affect population groups in different ways. Some impacts may be positive and expected, while others may be negative or unintended. In this CDG training chapter, learners will explore methods for identifying equity impacts, assessing unintended consequences, evaluating risks, and ensuring that decisions support fair and inclusive health outcomes. Equity impacts refer to the effects that decisions may have on different population groups. An intervention that benefits one group may create barriers for another. Health equity impact assessments, HEIAs, help identify these differences before implementation, allowing organizations to act proactively rather than reactively. Understanding how decisions affect different groups is foundational to building fair, inclusive, and effective health programs and services. Organizations often focus on intended benefits when designing programs and policies. However, unintended effects can create new disparities or worsen existing inequities among vulnerable populations. Early identification allows organizations to make adjustments before implementation, saving resources, protecting communities, and improving overall program effectiveness. It prevents new disparities from forming, enables proactive course correction, builds community trust and confidence, and supports evidence-based decision-making. Positive equity impacts occur when a decision improves health outcomes or reduces barriers for underserved populations. Recognizing these impacts helps strengthen effective strategies. Expanded healthcare access brings services closer to communities that previously lacked adequate coverage. Improved transportation reduces geographic barriers so more people can reach health services reliably. Targeted support programs provide tailored solutions to populations with the greatest unmet needs. Removing financial, linguistic, and logistical obstacles ensures equitable participation. Negative impacts occur when decisions unintentionally disadvantage certain groups. Identifying negative impacts is a core objective of health equity assessments. Reduced service access may inadvertently limit access for populations who rely heavily on specific services or delivery channels. Financial burdens may disproportionately affect low-income households, creating new barriers to care and participation. Language barriers present only in dominant languages may exclude non-English speaking communities from accessing critical health information. Technologically dependent services may disadvantage older adults, rural populations, and those with limited digital literacy or internet access. The expected results of a decision, outcomes that planners anticipated and designed the intervention to achieve, are the goals and objectives that motivated the policy or program in the first place. Outcomes that were not anticipated during planning can be positive or negative and may affect populations differently. Unintended consequences are often the most significant equity concern. Health equity impact assessments are specifically designed to surface unintended consequences before they cause harm to vulnerable populations. Direct impacts occur immediately as a result of a policy or program. They are the most visible and easiest to measure, often appearing as soon as an intervention is implemented. Indirect impacts emerge through secondary effects and may influence health outcomes over time. They are often harder to detect but can be equally or more significant than direct effects. Comprehensive assessments consider both types of impacts to ensure a complete picture of how decisions affect different population groups. Some impacts appear quickly, while others develop gradually over months or years. Health equity assessments should evaluate both short-term and long-term implications. Immediate effects are visible within days or weeks of implementation, often the most direct and directly attributable to the intervention. Short-term effects emerge over weeks to months, including changes in service utilization, community awareness, and early health behavior shifts. Medium-term effects develop over 1 to 3 years, with changes in health outcomes, equity indicators, and community well-being metrics. Long-term effects that emerge over years or decades are often the most significant for health equity, including generational changes in population health. Impact analysis begins by identifying who may be affected by a decision. Different groups may experience very different outcomes from the same policy or program. Children, older adults, and different life stages may face unique vulnerabilities and needs that require tailored consideration. Gender identity and expression can influence how individuals experience health services and the impacts of policy decisions. Socioeconomic status significantly shapes access to healthcare, transportation, and the ability to navigate complex systems. Cultural background and geographic location, urban, rural, or remote, create distinct patterns of access and vulnerability. Physical, cognitive, and sensory disabilities may create specific barriers that standard program designs fail to address. Vulnerability refers to the likelihood that a population may experience negative effects. Understanding vulnerability helps prioritize mitigation efforts and direct resources where they are most needed. Financial hardship limits the ability to access services, absorb costs, and navigate complex health systems. Marginalized communities may face systemic barriers that compound the negative effects of policy decisions. Geographic, financial, or structural barriers to healthcare increase the risk of negative impacts. Discrimination in health settings reduces trust and engagement, amplifying vulnerability to inequitable impacts. Consequence mapping is a technique used to visualize potential outcomes and their relationships. The process helps organizations identify direct, indirect, intended, and unintended effects, improving understanding of complex decisions. By systematically tracing how a decision flows through to outcomes, consequence mapping reveals risks and opportunities that might otherwise be overlooked during the planning process. Assessors often ask structured questions to identify equity impacts. These questions support systematic analysis and ensure that no population group is overlooked. Who benefits? Which populations are most likely to experience positive outcomes from this decision, and how significant are those benefits? Who may be disadvantaged? Which groups may face negative consequences, increased barriers, or reduced access as a result of this policy or program? What barriers may arise? Are there financial, geographic, linguistic, digital, or cultural barriers that could prevent equitable access? How do impacts vary across populations? Do different groups experience the same change in fundamentally different ways? And what does that mean for equity outcomes? Risk identification methods help organizations recognize potential adverse consequences. Multiple approaches improve assessment quality and reduce the likelihood of overlooking significant risks. Stakeholder consultations engage community members, service users, and frontline workers to surface risks that data alone may not reveal. Data analysis involves reviewing existing health data, demographic information, and service utilization patterns to identify vulnerable populations. Brainstorming sessions structure creative discussions that encourage teams to think creatively about potential consequences. Scenario planning involves developing and analyzing multiple future scenarios to understand how opportunities might be affected under varying conditions. Evidence from research, community consultations, and previous assessments can help predict likely impacts. Organizations should use the best available information to support their analyses. Evidence-based assessments improve decision-making by grounding predictions in real-world data rather than assumptions. When evidence is limited, organizations should acknowledge uncertainty and apply the precautionary principle. Evidence-based assessments lead to more accurate impact predictions and more effective mitigation strategies. Not all impacts carry the same level of importance. CDGTraining emphasizes that prioritization helps focus resources on the most significant equity concerns. Organizations should prioritize impacts based on a combination of these criteria, ensuring that the most serious risks to the most vulnerable populations receive the greatest attention and resources. A healthcare organization introduced a digital appointment booking system to improve efficiency and reduce administrative burden. While the system offered clear benefits for many end users, the Health Equity Impact Assessment identified barriers for at-risk groups. The organization introduced telephone support services and community assistance programs, reducing the risk of digital exclusion and ensuring equitable access for all patient groups. This case demonstrates how early equity assessment prevents unintended harm and leads to more inclusive service design. Health equity impact assessments often identify impacts across multiple dimensions. Service access and health outcomes frequently represent the largest areas of concern in organizational assessments. These findings highlight that service access-related impacts are the most commonly identified concern, underscoring the importance of addressing barriers that are physically, financially, and digitally accessible to all population groups. Organizations use multiple criteria to determine which impacts require the greatest attention. Prioritization helps ensure that significant risks are addressed effectively and resources are directed where they matter most. Financial barriers and service reduction score highest on severity, while digital exclusion and financial barriers are among the most likely to occur, making them priority areas for mitigation planning in most health equity assessments. Advances in analytics and digital technologies are improving the ability to predict equity impacts. Future assessments will become increasingly proactive and evidence-driven. AI tools can analyze vast datasets to identify patterns of inequity and predict which populations are most at risk from proposed policy changes. Advanced modeling techniques simulate the potential effects of decisions across different population groups before implementation begins. Sophisticated visualization tools help organizations communicate complex equity impacts clearly to decision-makers and community stakeholders. Identifying equity impacts and unintended consequences is one of the most important steps in the Health Equity Impact Assessment process. Organizations that systematically evaluate positive and negative effects can make more informed decisions and reduce the risk of unintended inequities. The most successful health equity assessments look beyond intended benefits to identify how different populations may experience both positive and unintended consequences. Health equity impact assessments require structured tools and methodologies to evaluate how decisions affect different populations. These tools help organizations move from assumptions to evidence-based analysis. In this chapter, learners will explore practical health equity analysis tools, assessment methodologies, prioritization frameworks, and decision support techniques used in professional health equity impact assessments. Analysis tools provide structure, consistency, and transparency during assessments, ensuring every evaluation follows a reliable process. Without a systematic approach, important equity impacts may be overlooked, leaving vulnerable populations without adequate consideration. Well-designed methodologies improve decision quality and accountability, building trust in the assessment process and its outcomes. Methodologies guide assessors through every phase of a health equity impact assessment, from data collection to final recommendations. They support reliable outcomes and ensure that assessments follow a logical, evidence-based process that can be replicated and reviewed across different contexts. Screening tools help determine whether a policy, program, or initiative requires a full health equity impact assessment before significant resources are committed. They identify potential equity concerns early in the planning process, improve efficiency by focusing resources where most needed, and support consistent application across different programs. Screening tools often include targeted questions designed to surface equity concerns before a full assessment is initiated. These questions help assessors determine the significance of potential equity impacts and support early, informed decision-making. An equity lens is a structured way of examining decisions from the perspective of fairness and inclusion. It asks how different groups may experience the same policy or program differently. This approach encourages organizations to consider how different groups may experience outcomes, those who are often invisible in aggregate data. Assessment matrices organize information about population groups, impacts, risks, and mitigation strategies into a clear, comparable structure. They provide a visual structure for comparing potential effects and help teams evaluate complex information systematically across multiple dimensions. Frameworks identify both intended and unintended consequences across population groups: improved access, better health outcomes, reduced disparities. They also surface potential harms, unintended exclusions, resource misallocations, or widened inequities. Structured analysis improves assessment consistency and ensures that both intended and unintended consequences are captured across all affected population groups. Risk assessment tools evaluate the likelihood and severity of potential impacts, giving organizations a structured way to understand what could go wrong, and how seriously. They prioritize concerns and allocate resources effectively, ensuring that the most significant risks receive the most attention and mitigation effort. Population profiling helps organizations understand the characteristics of affected communities before and during an assessment. These insights support more targeted assessments by ensuring that the specific needs, vulnerabilities, and strengths of each community are understood and reflected in the analysis. Equity mapping uses geographic data and spatial analysis to identify disparities and service gaps across communities. It transforms complex data into visual representations that are accessible to decision-makers and stakeholders. Spatial analysis supports evidence-based planning by making disparities visible and geographically actionable. Many organizations use scoring systems to evaluate the significance of equity impacts in a structured, objective, and comparable way. Rating systems support objective prioritization by reducing reliance on subjective judgment and making the basis for decisions transparent and auditable. Prioritization frameworks help organizations focus on the most significant equity concerns when resources and time are limited. They improve resource allocation by ensuring that the most critical equity concerns receive attention first, rather than being addressed in an ad hoc or politically driven manner. Decision support tools combine evidence, stakeholder input, and analytical methods to guide recommendations. They bring together quantitative data and qualitative insights into a unified framework for action. Decision support improves strategic planning by ensuring that recommendations are grounded in evidence rather than assumption. Organizations often combine screening tools, risk assessments, stakeholder engagement methods, and data analysis techniques to build a comprehensive picture of equity impacts. Integrated approaches provide the most comprehensive understanding of equity impacts, reducing blind spots and strengthening the credibility of recommendations. A regional health authority planned to launch a preventive health program targeting chronic disease within a high-need urban-rural service area. The integrated assessment identified significant barriers affecting rural communities, including transportation limitations, limited digital literacy, and reduced access to care, barriers that would have been missed by a standard program review. The use of multiple tools transformed a potentially inequitable program into one that actively reduced disparities. Health equity impact assessments typically combine several analytical tools and methodologies. Using multiple approaches improves reliability and completeness of the assessment. Each tool contributes a distinct perspective, forming a robust methodology that captures the full complexity of equity impacts across population groups. Organizations use structured criteria to determine which impacts require immediate attention. Prioritization helps focus efforts on the areas of greatest need and potential benefit. By applying these criteria consistently, organizations can make transparent, defensible decisions about how to direct assessment resources and mitigation efforts. Emerging technologies like AI, machine learning, predictive analytics, and advanced visualization help organizations identify trends and forecast impacts more effectively. Future methodologies will increasingly leverage digital innovation to make health equity assessments faster, more accurate, and more inclusive. Health equity analysis tools and methodologies provide the structure needed to conduct rigorous and effective assessments that lead to meaningful change. Organizations that apply screening tools, assessment matrices, risk frameworks, and decision support methods can better understand equity impacts and develop more defensible recommendations. Integration of tools is essential for transforming equity challenges into practical, actionable responses. Emerging digital tools expand what is possible in equity analysis, enabling faster, deeper, and more inclusive assessments than ever before. Public policies influence many aspects of health, including healthcare access, education, housing, employment, transportation, and environmental conditions. These decisions can improve health outcomes for some groups while creating barriers for others. In this CDGTraining chapter, learners will explore how policies are assessed through a health equity lens to identify potential disparities, promote fairness, and support more inclusive outcomes. Policy assessment is the process of evaluating the potential effects of proposed or existing policies. The goal is to understand how decisions may affect different populations and whether inequities could be created or reduced. Assessment supports informed policymaking by surfacing impacts before decisions are finalized. Many factors that influence health outcomes are shaped by public policy. Housing regulations, transportation systems, education programs, and healthcare funding are crucial areas. These policies determine living conditions, access to healthcare, and education, ultimately affecting population health. A structured approach used to evaluate how policies affect different groups, encouraging decision-makers to consider fairness, inclusion, and potential unintended consequences. Applying an equity lens helps reveal disparities that might otherwise go unnoticed. Health equity impact assessments can be applied across many policy areas. Policies involving healthcare delivery, housing development, public transportation, social welfare, and education frequently have significant equity implications. Cross-sector analysis is often necessary. Policy assessments begin by identifying which populations may be affected. Particular attention should be given to vulnerable and underserved groups that may experience disproportionate impacts. Understanding population characteristics, including demographics, geography, income, and cultural background, improves the quality and relevance of analysis. Assessors should understand the goals and intended outcomes of a policy before evaluating impacts. Clear objectives help determine whether the policy is likely to improve or worsen health equity. Alignment between goals and outcomes is essential. Direct impacts are the immediate effects experienced by affected populations as a result of a policy change. They are often the most visible and measurable outcomes. Examples include increased healthcare access, expanded benefits, and reduced costs for essential care. Indirect impacts emerge through secondary effects and may take time to appear. They are important considerations in equity assessments because they can significantly shape long-term outcomes. For example, transportation policies may influence employment opportunities, healthcare access, and overall well-being. Policies should be evaluated for their impact on access to services and opportunities. Barriers can create or worsen inequities across communities. Considerations include affordability, geographic access, language access, cultural appropriateness, and usability. Economic effects often influence health outcomes significantly. Policies may affect income, employment, healthcare affordability, and access to essential services. Economic assessments help identify potential equity implications before they materialize. Policies can influence social participation, cultural inclusion, community relationships, and trust in institutions. Assessments should consider how different groups may experience these effects, as social impacts often shape long-term health outcomes. Many policy decisions involve trade-offs between competing priorities. A policy may generate overall benefits while negatively affecting certain groups, creating winners and losers within the same population. Without equity analysis, these trade-offs may go unrecognized until harm has already occurred. Evidence from research, population data, stakeholder consultations, and previous policy experiences supports robust analysis. Evidence-based policymaking reduces uncertainty and improves decision quality. Reliable information strengthens recommendations. Recommendations should address identified risks and opportunities. CDGTraining emphasizes that recommendations should be practical, evidence-based, and focused on reducing inequities. A city government proposed changes to public transportation routes to improve overall system efficiency and reduce operating costs. A health equity impact assessment found that several low-income communities would experience reduced access to healthcare facilities and employment centers as a result of the proposed route changes. The city revised the transportation plan, maintaining critical routes and improving service accessibility for affected populations, demonstrating the real-world value of equity-focused assessment. Health equity impact assessments are applied across multiple sectors because many areas influence population health. Cross-sector collaboration is often essential for addressing inequities effectively. Policy assessments evaluate multiple dimensions of impact to ensure comprehensive analysis. Population impact and accessibility are among the most important considerations. Governments and healthcare organizations increasingly use advanced analytics and digital tools to support policy evaluation. Future policymaking will become more proactive and evidence-driven. Assessing policies through a health equity lens helps organizations understand how decisions affect different populations. Structured policy analysis identifies potential inequities, informs recommendations, and supports fairer outcomes. In this chapter, we delve into evaluating programs, services, and interventions to improve health outcomes and address community needs. Learners will explore methods to assess effectiveness, equity impacts, and long-term outcomes. Program evaluation involves systematic assessment to ensure objectives are met and improvements are made. It supports accountability and continuous learning across organizations. Evaluation is crucial for health equity, ensuring no group is overlooked. It identifies disparities and drives targeted improvements for underserved communities. Health equity impact assessments apply to various initiatives, requiring careful evaluation to understand their true impact. Evaluation should occur throughout a program's lifecycle, supporting timely improvements and course corrections. Formative evaluation occurs during program development to prevent future challenges. It strengthens program design by addressing potential risks early. Process evaluation examines how a program is implemented, focusing on service delivery, participation, resource utilization, and operational effectiveness. Outcome evaluation measures the results achieved by a program, determining its effectiveness through health indicators, service access, disease prevention, and well-being. Impact evaluation focuses on sustained improvements and systemic effects, often requiring extended monitoring to assess long-term changes. Equity-focused evaluation questions ensure all population groups experience similar benefits, revealing hidden disparities and strengthening overall evaluation quality. Participation data helps organizations understand who benefits from services, revealing patterns that aggregate data might obscure. Quality evaluation examines service delivery effectiveness and consistency, directly influencing program success and participant experience. Health outcomes provide evidence of program effectiveness, supporting evidence-based decision-making across various indicators. Programs can create unintended effects, both positive and negative, that evaluators should identify to support future improvements. Using multiple data sources provides a complete picture of program performance, combining quantitative and qualitative evidence for strong evaluations. A case study on a community diabetes prevention program highlights how evaluation findings can drive improvements that benefit underserved populations. Comprehensive evaluations examine multiple dimensions of program performance, focusing on implementation quality, outcome measurement, equity impact, and more. Evaluators use multiple indicators to assess effectiveness and fairness, focusing on accessibility, outcomes, equity impacts, and satisfaction. Emerging technologies are transforming program evaluation, making it more data-driven and responsive to real-time community needs. Effective evaluation is essential for understanding effectiveness, identifying inequities, and supporting continuous improvement, ensuring benefits reach everyone. Equity-focused decision-making ensures that health policies consider fairness, inclusion, and the needs of vulnerable groups. This chapter explores frameworks and methodologies to support equitable outcomes. Equity-focused decision-making integrates health equity considerations into planning, implementation, and evaluation processes. It examines how actions may affect different populations and aims to reduce unintended disparities. Equity must guide decisions to prevent unintended disadvantages for certain groups. Health equity impact assessments help identify and address these risks before implementation. Equitable decisions are guided by principles like fairness, transparency, participation, accountability, and evidence-based approaches. These principles ensure diverse perspectives are considered. Decision-making frameworks help evaluate alternatives and select appropriate actions, ensuring no population group is overlooked during planning. Evidence supports objective and informed decisions. Quantitative data, qualitative insights, and stakeholder feedback are crucial for achieving equitable outcomes. Identifying risks in health equity assessments involves recognizing potential events that could negatively affect population groups. Early identification improves preparedness and response capacity. Equity-related risks span social, economic, environmental, cultural, technological, and policy domains. Understanding these categories improves analysis quality and ensures comprehensive assessment coverage. Risk assessment evaluates the likelihood and severity of potential impacts on population groups, transforming uncertainty into actionable intelligence for planners. Risk matrices provide a visual method for evaluating and comparing risks, helping organizations prioritize actions effectively. Vulnerability analysis strengthens equity-focused decisions by revealing who needs the most protection, considering factors like income, age, and geography. Balancing benefits and risks involves evaluating potential impacts and ensuring equitable distribution of benefits across populations. Scenario planning helps organizations anticipate possible outcomes under different conditions, improving decision quality and preparedness. Equity-centered governance supports sustainable equity outcomes through accountability, stakeholder participation, continuous review, and transparency. Risk mitigation involves developing actions that reduce the likelihood or severity of negative impacts, emphasizing early planning and community engagement. A healthcare provider expanded digital health services, addressing potential inequities through targeted mitigation measures. Common equity risk categories include access barriers, socioeconomic factors, and digital exclusion. Understanding these helps prioritize assessment efforts. Organizations use structured criteria to prioritize risks and allocate resources, ensuring decisions are informed by severity, population impact, and other key factors. Advances in analytics and digital technologies are transforming decision-making processes, making them more evidence-driven and equitable. Equity-focused decision-making and risk assessment help organizations evaluate potential impacts before implementing policies, ensuring more inclusive and equitable outcomes. Identifying equity impacts is only one part of the health equity impact assessment process. Organizations must also develop practical solutions that reduce risks, address disparities, and improve outcomes for affected populations. In this CDGTraining chapter, learners will explore mitigation strategies, improvement planning, intervention design, implementation approaches, and methods for reducing inequities identified during assessments. Mitigation strategies are actions designed to reduce or eliminate negative impacts identified during an assessment. These strategies help organizations address barriers, protect vulnerable populations, and improve equity outcomes. Effective mitigation transforms assessment findings into practical action that drives real change. Without mitigation, identified risks may continue to affect communities and contribute to persistent inequities over time. Mitigation planning ensures that organizations actively respond to assessment findings, improving accountability and effectiveness across programs and services. It drives organizational accountability, reduces ongoing community harm, and strengthens program effectiveness. Successful mitigation strategies should be evidence-based, achievable, measurable, and responsive to community needs. Solutions should focus on reducing barriers and improving access, participation, and outcomes. Strong planning supports successful implementation and long-term equity improvement. Mitigation efforts are most effective when they address underlying causes rather than symptoms. Organizations should investigate why disparities occur before selecting interventions. Observing disparities, investigating causes, and designing targeted interventions are key strategies to address root causes. Root cause analysis improves long-term results by ensuring that solutions address the true drivers of inequity rather than surface-level manifestations. Different situations require different approaches. Flexible strategies support diverse community needs and ensure that interventions are well matched to identified risks. These include policy changes, community engagement, workforce development, service redesign, resource allocation, and targeted support. Policies can often be adjusted to reduce negative impacts on vulnerable populations. Even small changes to eligibility criteria or access provisions can have significant equity implications. Policy improvements can significantly enhance equity outcomes and create lasting systemic change across programs and services. Service delivery improvements focus on making programs more accessible, inclusive, and responsive to the communities they serve. Extended hours, mobile services, multilingual support, and accessible facilities are key strategies to enhance service delivery. Some populations require additional support to achieve equitable outcomes. Focused interventions can significantly improve participation in health outcomes for those facing the greatest barriers. Transportation assistance, digital literacy support, financial barrier reduction, and cultural accessibility are essential components of targeted support programs. Communities often provide valuable insights into practical solutions that organizations may not identify on their own. Engaging stakeholders during mitigation planning helps ensure that interventions are relevant and effective. Collaboration improves implementation success and ensures that mitigation strategies reflect the lived experiences of affected populations. Resources should be directed toward areas of greatest need. Strategic investment helps reduce inequities by ensuring that underserved populations receive proportionally greater support. Additional funding, staffing investments, infrastructure support, and wraparound services are key strategies for effective resource allocation. Building organizational capacity supports sustainable improvements. Training programs, leadership development, and workforce education help organizations implement equity-focused initiatives effectively. Mitigation strategies require clear implementation plans to move from intention to action. Structured planning improves accountability and increases the likelihood of achieving intended outcomes. Responsibilities, timelines, resources, performance indicators, and monitoring processes are essential components of effective implementation planning. Organizations should monitor whether mitigation actions achieve their intended objectives. Regular evaluation helps identify successes, challenges, and opportunities for improvement. Continuous monitoring supports improvement and ensures that mitigation strategies remain responsive to evolving community needs. Not all improvement opportunities can be addressed simultaneously. CDGTraining emphasizes that prioritization helps maximize the value of mitigation efforts while focusing on the most significant equity concerns. Organizations should prioritize actions based on impact, feasibility, urgency, and available resources to ensure that the most critical equity gaps are addressed first. A regional health authority identified lower maternal health care utilization among women living in remote communities. The HealthEquity Impact Assessment highlighted transportation barriers and limited service availability as key drivers. Mobile maternal health clinics deployed to remote areas, transportation assistance programs introduced, and community health worker support networks established. Service utilization improved significantly, and maternal health outcomes strengthened across previously underserved communities. Organizations use a variety of mitigation approaches depending on the nature of identified risks and disparities. Combining multiple strategies often produces the strongest results. The most effective HEIA mitigation plans draw on multiple strategy types simultaneously, creating layered and reinforcing improvements across systems and services. Successful mitigation depends on strong leadership, sufficient resources, community involvement, and ongoing evaluation. Organizations that invest in these areas often achieve better outcomes. Emerging technologies are supporting more targeted and responsive mitigation strategies. Future improvement planning will become increasingly proactive and data-driven. Predictive analytics, digital engagement tools, real-time monitoring, and AI-assisted planning are key trends shaping the future of equity improvement planning. Developing mitigation and improvement strategies is essential for translating assessment findings into meaningful action. Organizations that address root causes, engage communities, allocate resources strategically, and monitor outcomes can reduce disparities and improve health equity. As taught in CDGTraining's framework, successful mitigation is not simply about reducing risks. It is about creating sustainable opportunities for healthier and more equitable communities. Health equity impact assessments do not end once a policy, program, or intervention is implemented. Organizations must continuously monitor outcomes, evaluate effectiveness, and report findings to ensure that intended equity improvements are achieved. In this CDGTraining chapter, learners will explore monitoring systems, evaluation frameworks, performance indicators, reporting practices, and accountability mechanisms that support long-term health equity success. Monitoring and evaluation help organizations determine whether interventions are achieving their intended objectives. They track disparities and provide evidence-based improvement, ensuring resources are directed where they are most needed. Monitoring is the continuous collection and review of information related to program implementation and performance. It tracks progress against established goals and targets, identifies issues early, and supports timely decision-making by providing real-time data. Evaluation examines the effectiveness, efficiency, and impact of policies, programs, and services. It provides deeper insights than monitoring alone, assessing outcomes, resource use, and opportunities for improvement. Both activities are complementary and essential for successful health equity initiatives. Monitoring involves ongoing performance tracking and real-time progress checks, while evaluation assesses whether goals were met and identifies opportunities. Indicators provide measurable evidence of progress toward health equity goals. Well-designed indicators support meaningful assessment and guide organizational decision-making, focusing on healthcare access, service utilization, health outcomes, and participation levels. Organizations use multiple indicator types to build a comprehensive understanding of results. Each type measures a different aspect of performance, including process, output, outcome, and impact indicators. Baseline data provides a starting point for measuring progress. Organizations collect information before implementation to enable meaningful comparisons over time. Accurate baselines are essential for credible evaluation. Outcome measurement focuses on changes in health status, well-being, and service accessibility. Organizations examine whether interventions improve conditions for affected populations, using data to support evidence-based conclusions. Equity outcomes examine whether disparities between population groups are increasing, decreasing, or remaining unchanged. Disaggregated data is essential to ensure improvements are distributed fairly. Monitoring systems rely on high-quality data from multiple sources. Consistent data collection supports reliable analysis, and data quality directly affects reporting accuracy. Reporting communicates findings to decision-makers, stakeholders, and communities. Reports should present results clearly, accurately, and transparently, providing recommendations that stakeholders can act upon. Different stakeholders may require different reporting formats. Tailored communication improves engagement and understanding, making findings accessible and relevant to everyday life. Accountability ensures that organizations take responsibility for outcomes and commitments. Transparency builds trust and encourages stakeholder confidence, supporting stronger governance and continuous improvement. Monitoring and evaluation findings should inform ongoing improvements. CDGTraining emphasizes that continuous improvement is essential for achieving sustainable health equity outcomes. A local public health agency implemented a nutrition program to improve food access in underserved communities. Monitoring revealed lower participation rates among certain groups, leading to culturally tailored adjustments and improved outcomes. Organizations monitor a variety of indicators to assess whether interventions are improving health equity. Outcome measures and access indicators are among the most commonly used metrics. Effective reports should provide accurate, timely, understandable, and actionable information. High-quality reporting supports decision-making and stakeholder engagement. Emerging technologies are transforming monitoring and evaluation practices. Future systems will become increasingly responsive and data-driven, utilizing artificial intelligence, predictive analytics, and interactive dashboards. Monitoring, evaluation, and reporting are essential components of effective health equity impact assessments. Organizations that measure outcomes, communicate findings, and continuously improve their interventions are better positioned to achieve sustainable equity goals. Technology is transforming healthcare delivery, public health planning, and health equity assessment. Digital tools provide new opportunities to identify disparities, improve access, and develop targeted interventions for underserved populations. In this CDG training chapter, learners will explore emerging trends, digital health technologies, artificial intelligence applications, and innovative approaches that are reshaping health equity assessment and healthcare delivery worldwide. Healthcare systems around the world are increasingly adopting digital technologies. Electronic health records, telemedicine platforms, mobile health applications, and data analytics systems are transforming how healthcare services are delivered and managed. Digital transformation is creating new opportunities and challenges for health equity. Digital health refers to the use of technology to improve healthcare delivery, population health management, and patient outcomes. It is becoming a major component of modern healthcare systems, reshaping how care is accessed, delivered, and monitored across populations. Digital technologies can improve healthcare access for populations facing geographic, mobility, or workforce barriers. Remote consultations and digital services can reduce travel requirements and expand access to specialist care. Not everyone has equal access to digital technologies. Differences in internet access, device ownership, digital literacy, and connectivity can create new forms of inequality. Health equity impact assessments should evaluate these risk factors carefully. Telehealth allows patients to access healthcare services remotely through digital communication technologies. The approach can improve convenience and access, particularly for rural and underserved communities. Organizations must ensure that telehealth services remain accessible to all populations. Equity-focused planning improves outcomes and prevents technology from excluding vulnerable groups. Artificial intelligence is increasingly used to support diagnosis, population health management, resource allocation, and predictive analytics. AI can increase diagnostic capacity and identify patterns that support decision-making. AI holds the promise to identify hidden patterns in population data and improve targeting of interventions for underserved groups. However, biased training data can encode and amplify existing inequities. Responsible AI development requires diverse data, transparent algorithms, and ongoing equity audits. Predictive analytics uses historical and real-time data to forecast future trends and outcomes. Organizations can use these tools to identify vulnerable populations and anticipate emerging health challenges. Predictive approaches support proactive decision-making. Big data combines information from multiple sources to provide broader insights into health trends and disparities. Data integration supports more detailed analysis of population needs and outcomes. Large datasets are increasingly valuable for equity-focused planning. Mobile health technologies provide health information, reminders, education, monitoring, and communication tools through smartphones and tablets. These solutions can improve engagement and accessibility for many populations. Wearable technologies collect health information such as heart rate, activity levels, sleep patterns, and other indicators. These devices support preventive care and population health monitoring, providing valuable health data that was previously difficult to obtain. Smart communities use technology to improve transportation, healthcare access, environmental monitoring, and public services. Integrated systems can help identify disparities and support targeted interventions. Innovation frameworks help organizations evaluate emerging technologies and the potential impacts on equity. CDGTraining emphasizes that innovation should improve equity rather than create new barriers. A national healthcare organization expanded telehealth services to improve specialist access in remote communities. The HealthEquity Impact Assessment identified digital literacy and connectivity challenges among certain populations. Healthcare organizations are increasingly using digital technologies to improve access, efficiency, and equity. Telehealth and mobile health applications are among the most widely adopted solutions. Multiple factors influence the success of health equity innovation initiatives. Technology alone is not enough. Policy support, workforce capabilities, and community engagement are equally important. Future health equity impact assessments will increasingly rely on artificial intelligence, predictive analytics, real-time monitoring, and integrated digital ecosystems. Organizations will have greater ability to identify disparities early and design more targeted interventions. Emerging technologies are transforming how organizations assess, monitor, and address health inequities. Digital health solutions, artificial intelligence, predictive analytics, and smart community initiatives provide powerful tools for improving healthcare access and outcomes. Creating lasting improvements in health equity requires more than individual assessments. Organizations must build sustainable systems, governance structures, and continuous improvement processes that embed equity into everyday decision-making. In this CDG training chapter, learners will explore how organizations establish long-term health equity impact assessment programs and create a culture of equity-focused leadership and accountability. Many organizations begin with individual health equity impact assessments and later expand them into organization-wide programs. Sustainable programs ensure that equity considerations become part of routine planning, policy development, and service design. Institutional commitment is essential for long-term success. Sustainable health equity programs are supported by interconnected elements that work together to create long-lasting improvements. Sustainability requires continuous effort and adaptation. Key characteristics include leadership support, adequate resources, staff training, stakeholder engagement, and performance measurement. Leadership commitment provides direction, resources, and accountability. When senior leaders actively support equity initiatives, organizations are more likely to achieve meaningful and measurable outcomes. Leadership sets the tone for organizational culture, shaping values, priorities, and the expectations placed on every team member. Formal policies help embed health equity principles into organizational processes, providing guidance for decision-makers and establishing expectations for consistent practice. Clear policies strengthen accountability. Governance structures help oversee implementation and monitor progress. Strong governance supports effective program management and ensures equity remains a strategic priority. Key components include equity committees, advisory groups, and dedicated leadership. Employees require knowledge and skills to apply health equity principles effectively. Capacity building strengthens organizational performance and ensures consistent, high-quality practice across all teams. Core training areas include assessment methodologies, stakeholder engagement techniques, cultural competence, and data collection and analysis. Health equity should be integrated into planning, budgeting, policy development, program design, and evaluation activities. Embedding equity into routine processes ensures consistent application and reduces reliance on isolated initiatives. Organizations should maintain ongoing relationships with affected populations rather than engaging only during assessments. Sustained partnerships build trust and improve program effectiveness over time. Long-term equity programs require dedicated financial, human, and technological resources. Organizations should incorporate equity initiatives into strategic and operational planning processes to ensure program continuity. Performance measurement helps organizations track progress and identify opportunities for improvement. Indicators should align with strategic objectives and health equity goals, supporting accountability and organizational learning. Health equity programs should evolve based on evidence, stakeholder feedback, and changing community needs. Learning organizations achieve stronger outcomes over time. Continuous improvement frameworks support adaptation and innovation, ensuring that health equity programs remain responsive, effective, and aligned with the communities they serve. Transparency strengthens stakeholder trust and organizational credibility. Organizations should regularly share progress and lessons learned to demonstrate commitment and build public confidence. Successful pilot projects can often be expanded to larger populations or additional regions. Growth should maintain quality and effectiveness throughout the scaling process. Scaling requires careful planning to adapt the model for new contexts, resource allocation to support expanded operations, and ongoing evaluation to ensure quality is maintained. Future leaders will need strong skills in collaboration, systems thinking, data interpretation, and stakeholder engagement. Leadership will play a critical role in advancing health equity agendas globally. A national healthcare organization sought to move beyond ad hoc equity efforts and integrate health equity impact assessments into all major policy and program decisions systematically. Over several years, measurable improvements were observed in healthcare access, stakeholder engagement, and disparity reduction initiatives, demonstrating the power of sustained, systemic commitment to health equity. Sustainable programs depend on multiple interconnected components working together. Leadership, workforce development, and community engagement are particularly important foundations. Organizations typically progress through multiple stages as health equity programs mature. Long-term success depends on continuous learning, adaptation, and improvement. Throughout this course, learners have explored a comprehensive framework for advancing health equity in practice. CDGTraining equips professionals with practical tools and knowledge that can be applied across healthcare, government, public health, and community organizations worldwide. If you wish to undergo a complete professional course on this subject and earn a recognized certification, visit cdgtraining.com and enroll in the Advanced Health Equity Impact Assessment professional course. This is a flexible, self-paced study program allowing you to learn at your own pace, from anywhere in the world, and apply for the exam online. You can check the course link in the video description. Thank you for completing the Advanced Health Equity Impact Assessment professional course. We wish you continued success in advancing health equity, improving population health outcomes, and creating positive change within your organization and community.